All right, continuing on with lecture 3. Now moving into 3B, right? So how do we develop our gender identity? Where does that come from, that internal sense of self as being male or female or something other or in between? So just to remind ourselves, right, gender identity, that's that internal sense of self, right, as male or female or something between or something other, right? And if your gender identity happens to kind of match up with your biologic sex, it may not feel like that's something that's different, but it actually is a very separate experience. You can think of it as brain sex as opposed to your body sex, or brain gender as opposed to body gender. Right? So there are lots of different options for gender identity. So kind of looking at the second bulleted list here, right? You could be female identified, male identified. You could say that you're bigender, which means you associate with both types of identity, or maybe non-binary or gender queer, which could be kind of a combination or something in between. Gender fluid, it's like, oh, it changes depending on what circumstance I'm in. I think a lot of us experience that, at least to a small extent, from time to time. Or some people will say that their experience is that they are agender. They don't really seem to have a gender or an affinity for one gender or the other. Then furthermore, we have two other terms. So cisgender, cis comes from the word cis, which means on the same side as, and that's how we describe people whose gender identity or sense of self is congruent, or what we would stereotypically expect for somebody with that particular biologic sex. So a female-bodied person who identifies as female. Right? Whereas somebody who is transgender, trans as a prefix means across from, right? To transport literally means carry across. So it's across from. So their gender identity is kind of across from, or not what we would expect for their biologic sex. So somebody who's female-bodied but has a male gender identity, for example. So here's kind of a chart of that terminology, so you can kind of put it together, right? So we're looking at somebody's gender identity, their internal sense of self, as how it relates to their biologic sex or their body sex, their body parts, right? So if you are male identified, all the terminology that we're going to use to refer to somebody whose brain gender is male is as a man, right? So we might say they are a transgender male or transgender man, or sometimes the word is used as trans man, as opposed to somebody who is a cisgender male who has a male gender identity and a male biologic sex. Over under the female column for gender identity, right, if your body is female-bodied, then we would call that person a cisgender female. And if they were male-bodied, we would say they're a transgender female or a trans woman. So again, we're going to use the word that fits with their gender identity, right? So that's how you can kind of remember that. You can also notice too that we don't have good words for intersex, non-binary, and genderqueer people, right? So it's like we kind of don't have terminology to kind of reflect based on your biologic sex, kind of those middle gender identities or biologic sexes. So how is gender identity determined? How does it get formed, right? Are there Wolffian ducts in the brain? No, there are other things in the brain though. And so one of the big ways that this conversation has been framed is not what's happening on the kind of molecular, hormonal, chromosomal, developmental basis that's causing something, but is it truly biologic, right? Is it how you are built? Meaning, is it nature or is it nurture, right? Is it something about the way you were raised, the way you were treated growing up that made you this way? So we have this kind of argument, right? Is it nature or is it nurture? Is it nature? Is it innate, something you were just born this way? Or is it nurture? Is it because of how you were raised or how you were treated while you were growing up? Is it learned? So, oh, look, there's that explanation, right, of that thing. Now, so what I want to point out is that in general, things that are seen as nature or inherent or innate, those are usually not things that are easily changeable, right? It is what it is. Whereas the idea is that if this is something that you kind of learned to be this way, right, it's a result of nurture, then maybe by changing the conditions or kind of retraining you, we could change it, right? So I think that's where a lot of the interest in this particular question comes from. So we'll go through some of the evidence that we have thus far to kind of answer this question. So one of the earliest psychologists to look at this issue was a man named Dr. John Money, and he worked at the Johns Hopkins Hospital in Baltimore, Maryland, which at the time actually, and this is in the 50s and 60s, had this huge gender clinic, and they had people coming from all over the country, and they were doing sex reassignment surgeries on people and all types of things. And Dr. Money himself was a psychologist, so a PhD, and he specifically worked with intersex people. And his idea about intersex people, right? So this was always, kind of a crisis at that point in time in that generation. And when an intersex child was born, it's like, oh, well, you have to be either a boy or a girl. We can't let you be something in between. So we have to pick one for you and turn you into that gender so that you can live a normal life. And so these were the folks that he worked with. And so his theory was that we are all gender neutral in terms of our brain at birth, right? So his theory that we all start off kind of a tabula rasa, a blank slate, and it is merely a result of how we are learned or how we are raised that turns us into, in our heads, a girl or a boy, right? So we all start out gender neutral. That's his theory. And it's purely a result of being dressed in pink versus blue, being told that you're a girl or that you're a boy, being given certain types of clothes, being encouraged to behave in certain ways that develops your sense of gender identity. That is a learned thing. So this is that information in case you need to pause and catch up with any notes that you might be taking. And so he believed this based on his experience working with intersex children. I'll just stop there. All right. So the trouble with Dr. Money's studies, there were a lot of problems with Dr. Money's studies. Actually, in retrospect, we've learned a lot since then. We've learned a heck of a lot since then. But one of the problems that he found, as a researcher, was that these were intersex children that he was working with. And in his experience, they seemed to be able to do just fine being raised as either boys or girls. But you could make the argument, right, that intersex children maybe are a little bit boy and a little bit girl already. So perhaps in that case, sure, you can make them feel like, yes, I'm a boy or yes, I'm a girl, because they already had kind of the seeds of that gender somewhere in their makeup, right? But what about somebody who's not intersex, right? That was the big question, right? What about, somebody who's born male? Could you raise them to believe that they are a female and to have them totally identify as female? Could you, as a result of how you raised them, make a male-bodied person have a female gender identity, right? Or vice versa. And this was a really, it was a difficult thing. It's not like he could just do an experiment like that. But what ended up happening is the case of the Reimer family. So the Reimer family was actually a young couple in Canada, and they happened to have twin boys. Not only twins, but identical twin boys. So in terms of psychological research, right, identical twins are amazing because they are genetically identical to each other and they are being raised in the same household, right? So it's a really powerful way to look at the influence of genetics on different things. But in any event, what happened was that during the routine circumcision that is done usually shortly after birth with one of the twins, there was an equipment malfunction and they accidentally cut off his penis. Yes, you heard that right. They accidentally cut off his penis. So this was, devastating and an emergency, right? They're like, oh my gosh, what do we do? And the feeling at that time was that, well, you can't be a boy or a man if you don't have a penis. It's just not possible, right? So they, traveled down to Baltimore and they went to see Dr. Money because he's the big expert. And he said, oh, perfect. We're going to do surgeries on this child's genitalia to make them look like a girl, and you can do that, right? And then we're going to raise this child as a girl. You will never tell this child about what happened. You will never tell this child that they are XY, that they used to have male genitalia, and you will just raise them as a girl, and they'll be fine. And so that's what they did, right? And so the Reimer family would come down to Baltimore about once a year for a checkup appointment for about an hour. And based off of their experience, John Money said, aha, this is a success. So even in non-intersex people, based on this one example of this one patient once that I see once a year, yes, aha, my theory is correct. So obviously I'm leading up to something here that maybe it wasn't correct. So I raised this child as Brenda, right? And things seem to be okay, right? But then unfortunately, by the time, and there you can see the two twins, the not older, but the twin brother who's raised male is kind of on the left, and then Brenda is in towards the center of the picture. By age 11, Brenda had suffered multiple depressive episodes and was soon in and out of the hospital multiple times with suicide attempts. The family was desperate. They didn't know what to do for this child. And so they eventually told their child, well, you know what, actually, I don't know if this has anything to do with it, but, and kind of disclosed the history. The child who was being raised as Brenda then transitioned and said, well, this is not who I am, right? And they had been treating them with estrogen. And so they transitioned to male. And so this showed that this was not a success, right? It ends up being a terribly sad story that probably lends credence to the fact that it's really abusive to do this to someone. And this child ended up basically committing suicide, as did the other brother eventually. So it's a really sad story, actually, but it's fascinating and very compelling. And it's, you know, Dr. Money still for years said, this example proves that I was right. But really, this was a fail, right? So we do not have any evidence to support John Money's theory of gender neutrality. So far, it doesn't look like you can just train someone to have a gender identity of one thing versus the other. All right, here is that information in case you needed to take some notes. So that argument doesn't really kind of hold up. There's another argument that it must just be something that's learned because there's this belief that you can change it, right? So there is a belief that you can change your gender identity by undergoing either counseling or religious interventions or a combination of the two. This is often called conversion therapy. And it has been touted by a lot of people to be the answer, right, to people who are struggling with gender identity. Unfortunately, we have really good evidence that shows that this is not effective. It doesn't work, like, at all. It does not work. And it actually can be really harmful to people, right? But there are still some people who say, no, actually this works, and will put things on YouTube or the internet that say, no, this absolutely still works. And we encourage you to come get treatment at our facility. But the evidence is clear enough. The American Psychological Association, which is the professional association for all psychologists, has said, no, like this is ineffective and it's harmful, right? This is actually damaging to people to try to change their gender identity. So we actually have a lot of really good scientific studies that show that you cannot change somebody's gender identity. In fact, you'll just make them feel horrible about themselves. So it doesn't seem like something that we can change. And people have tried really, really hard to change it. So let's look at the other side of the coin. Do we have any evidence to suggest that gender identity is innate, right? That you're just kind of born this way and it is how it is, right? It's just how your brain is wired, so to speak. Well, let's look at it. So one of the things that we have is actually what's called concordance, meaning going together, of transgender identity in identical twins. So again, identical twins are really powerful because they are genetically identical to each other. So what does this mean? So it turns out if you have an identical twin and they're transgender, then there's a 20 to 40% chance that you will be too, right? Which is, so it's not 100%, right? It's not as if your genes are the only thing that determine your gender identity, but there's a strong influence of your genetics on your gender identity, right? Because overall in the population, it's less than 1%. And when they look at non-identical twins, because it's like, oh, maybe it was just how you were raised. When they look at non-identical twins, you're no more likely to be transgender if your non-identical twin is trans than if you're just part of the general population. So this supports the idea that there's a genetic influence, right? That it's not 100% genetically determined, but there are some genetic things that can predispose you to have a certain gender identity versus a different one. Remember congenital adrenal hyperplasia. So that's one of those intersex conditions. And so that's that intersex condition where you're XX, but your adrenal glands make extra testosterone. So what happens is later in fetal life, you end up with genitalia that is kind of ambiguous or kind of somewhere in between stereotypical male and female, right? So these are individuals whose brains, of course, are also being exposed to very high levels of testosterone during a time in the pregnancy when we know a lot of brain development is happening. So that's kind of interesting to think about. What do we find? So in these XX individuals who have extra testosterone around, we do know that they tend to choose more stereotypically male play behaviors than traditional XX girls, right? In terms of the toys they like to play with or the playmates they choose to hang out with. Most people with congenital adrenal hyperplasia do identify as female, but there's actually a higher proportion of them whose gender identity is male than we would expect in the general population. So they are more likely to have a transgender gender identity than somebody who doesn't have that excess testosterone late in pregnancy. So this supports that idea, right, that there could be something to being exposed to certain levels of hormones at different stages in pregnancy that might kind of sex the brain, which is primarily those centers that have to do with personality, aren't developing until very late in pregnancy, right? Like you don't even have basic reflexes until like halfway through pregnancy because the nervous system is not well developed early on, right? So the higher functions of the brain, like personality, are developed later in pregnancy. The genitals were developed really early in pregnancy, relatively speaking, right? So it's like, oh, is this maybe your body gets sexed one way, but then your brain gets sexed another way because of changing hormone levels? I don't know. It's interesting, right? But it supports the idea that maybe hormones could be a part of this. Also, looking at, there's another condition called cloacal exstrophy that you didn't learn about during intersex, because what's interesting with these boys is that they have normal testes and normal hormones and everything, but because of a problem with the urogenital sinus and the cloaca, they end up with no penis, right? So even though they had a genital tubercle and even though they had testosterone, they end up with no penis. And so historically, again, the thought has been, if you don't have a penis, how could you ever be a boy or a man? So historically, they have raised these people as female. But what's interesting is when you follow up with them later, and again, most of these kids were not told anything, right? They're just told you're a girl. About half of them later, like, I think I'm a girl, right? Without, or I think I'm a guy, right? Without ever having been told, right, about that history. So, so there's this idea that there's evidence, right, that the brain does seem to be gendered a certain way, and we don't seem to be very good at kind of just changing it. Again, showing Dr. Money's theory doesn't seem to hold true. And there's another piece of evidence that it might be innate, which is when we actually look at brain structure. So we're going to look at some slices of brains from people that were kind of taken and stained and looked at under the microscope after the people died, right? So this is a difficult type of study to do, but can give you some really interesting information. So we're looking particularly at a part of the brain called the hypothalamus, which we're going to come back to that again next week. Hypothalamus is a fascinating part of the brain, has to do a lot with, we think, with sexual behaviors and gendered behaviors. And so here we have a slice of a brain of this particular region of the brain in a heterosexual male. And we see these kind of deeply, darkly staining cells. They're staining for a certain type of compound, and it shows up, really darkly. We compare this to this slice of a brain, which is a heterosexual female, and we can see, well, gosh, male versus female brain looks very different, right? So we call this dimorphism, right? There's this different appearance, different shape, different structure, right, based on their sex. But then they're like, oh, but maybe it's not their sex, but their sexuality, right? Maybe it's their sexual orientation or something. So they said, well, let's look at the brain of a homosexual male. And they found that, in fact, it tends to look just like the heterosexual male. So this seems to be something that is tracking more with your gender identity than your sexual orientation. And then when they looked at the brains, and they did this in several different people, of trans women, right? So these are male-bodied people whose gender identity was female. Their brains looked a lot like the heterosexual female brains, right? So what we're seeing is that idea that you have a brain gender and a body gender, right? And that does seem to be like in a trans woman, like they really have a female brain as best we can tell, right? Which is kind of really cool and interesting. And you'll see this study is from 1995. This is not new. There have been other studies that have replicated this since, but it's really interesting. One of the things that I find particularly compelling about the evidence in this study is that some of the trans women's brains they looked at were people who took estrogen as hormone therapy to transition, and some people didn't, right? So some people never took estrogen and didn't have estrogen circulating through their bodies, and yet their brains still looked this way. So it looked like something that was kind of present there from the get-go, not a result of exposure to hormones later in life, at least. Maybe during fetal development and pregnancy, but not later in life. All right, so again, these are called the sexually dimorphic areas of the brain, right? Certain areas of the brain look one way in people who have a male gender identity and another way in people who have a female gender identity. And it doesn't matter what hormones you're exposed to later in life, which is interesting. So this idea that there's actual structural differences in the brain is pretty compelling. All right, what else? We also know that there have been transgender and gender diverse people throughout different cultures and throughout history. So in your book, they talk about the Hira in India, the Two-Spirit folks in many Native American cultures. And, in the Philippines, there are more than 5 genders recognized, right? So there are lots of cultures that have acknowledged that there seems to be a very diverse human experience in terms of our gender identity. So when you see that in a lot of different cultures across space and time, you think, oh, maybe this is just part of the inherent variety of human existence, right? This is just some of the different ways humans are made. This is Dr. James Berry. It was a fascinating story. So Dr. Berry was the first surgeon to ever successfully perform a C-section, right? Pretty daring thing to do at the time. This was in Scotland, pretty sure Scotland, might have been England, but the UK for sure. And the really interesting thing about Dr. Berry is that after Dr. Berry died and they were preparing his body for the funeral, they realized that Dr. Berry actually had female body parts, right? So Dr. Berry actually had biologic sex was female, but gender identity and gender expression was male, right? So this would be a trans man, kind of using our current lingo. Fascinating story. All right, so the summary of our evidence, right, is that everything that we have to date really supports the idea that your gender identity is kind of a fixed and innate part of you. It's just kind of how you're wired. And I've listed again here the kind of arguments and the data and the evidence that we have to support that. If you want to pause the video and check your notes, you're welcome to do that. Remember, cis versus trans is whether your gender identity is congruent with what we would expect for your biologic sex, in which case we call it cisgender, or not. If it's across from, we would call that transgender, right? So transgender is somebody whose biologic sex and gender identity are not what we would typically expect to go together. And what you can see here is, so when we look at Janet Mock or we look at Aiden Dowling, we might not think to ourselves and looking at that picture that they actually are somebody who's transgender, right? They might look like somebody who's cisgender. And so we're going to kind of talk just briefly about the experience of what it's like for some people who identify as transgender. So one of the things that some people who are transgender, but not all, experience is gender dysphoria. Gender dysphoria is an intense discomfort from that kind of mismatch between your brain gender and your body gender, right? So you may think of yourself as male, but when you look in the mirror every time you see a female-bodied person, and that can be very distressing. So what we know is that this can be so uncomfortable that for people who have gender dysphoria, the rate of suicidality, so suicidal ideation, and in some cases even suicide attempts, is as high as 40% and greater even. And so this can be a really, really challenging thing for somebody to live with. Now, not everybody who is trans has gender dysphoria, and there can be a huge spectrum in terms of some people their gender dysphoria is mild, and some people it's really severe, right? But in people who experience this, it can have a really profound impact on their lives and be incredibly distressing. So what we can do then is that we can allow them, or they can, we don't allow them, they can choose to transition, right? So they can choose to start to align their gender expression and maybe even their biologic sex more closely with their gender identity, right? So that they can live a life that feels more congruent and more comfortable for them, right? So here's some pictures of some people kind of before and after their transition. These individuals shown in these pictures not only changed their gender expression, but they also changed things about their body, right? So their biologic sex, we can change body things because we have incredible medical and surgical capacities now that we haven't always had. So certainly if you're going to change your gender expression, you can change your name, your pronouns, how you dress, how you style your hair, your posture, your speech patterns, right? All those things that we've talked about so that you are now expressing your gender in a way that is congruent with your gender identity. On the biologic sex side, there are actually a lot of things that we can do with hormones, but we can't do everything. So the interesting thing about hormones, as you'll know, because you know about the difference between primary and secondary sex characteristics, is that treating somebody with hormones helps them develop those secondary sex characteristics. But it will not change those primary sex characteristics that they were already born with. So it will not significantly change their anatomy in any way, right? It can change some things a little bit, make some features more pronounced, some features less pronounced. But if you really want to change other things, then you're looking at surgeries, right? And so they could be genital surgeries, or it might be chest surgeries to make the chest more congruent with what is typically traditional for somebody of that gender, facial surgeries to change kind of the contouring and other things to give them a more feminine or masculine appearance, right? So transition, because it can be so effective in alleviating gender dysphoria, which can be so damaging and harmful, is sometimes medically necessary, right? And so actually all of the major medical and psychological organizations support that this is medically necessary for people who are transgender who have gender dysphoria, because it can be life-saving, right? There are a few things that I do actually in my day as a physician that are often as life-saving as giving somebody access to hormone therapy for transition. So the American Medical Association, the American Association of Pediatrics, American College of Obstetricians and Gynecologists, the American Psychological Association, the American Association of Psychiatrists, they all agree that there is lots of evidence to say that this is a medically necessary thing and should be covered by insurance, right? This is real medicine. It is also important to remember that not all transgender people will transition, right? And even if they do, it can be different from one person to another, right? So I often use the example of people who have diabetes, which is problems with their blood sugar. Some people with diabetes, they just need to not eat cake, right? They just need to be better about their diet. Some people need to be careful about their diet and exercise more. Some people need to do those things and go on a medicine. Some people need to go on 2 medicines. Some people need insulin shots, right? So there's a wide variety of what is the correct amount of intervention for different people and at different times. So that's really important to remember. The other thing I want you to know, so this part at the bottom, right, is that it's never okay to ask somebody if they've had the surgery. That's a really private thing. And if you think about it, you don't ask your other friends about what their genitals look like, right? Like, this is just not something we do. So even if you're really curious, right? Because like, wow, like that's so amazing. Even if you think it's really cool and neat and you're like positive and accepting, it's still a really invasive question to ask somebody. So please don't ask somebody if they've ever had the surgery, right? That's rude. Okay. So in summary, so development of gender identity, right? So this is your internal sense of self, right? You could be cisgender or transgender or somewhere in between, right? We're talking a lot in the two binary poles here, but you could be somewhere in between. And our best evidence for how it develops is not that it's how you're raised or something that you're taught, right? It is innate. It seems to be something that's kind of inborn. It's just part of who you are. And we know that for people who are transgender, some of them have some profound discomfort from that kind of mismatch called gender dysphoria. And it can vary, but it can be alleviated by transitioning and kind of living a life in terms of how you move through the world, your gender expression, or even how your body is formed so that it feels more in concordance with and more comfortable with your gender identity. So that's it for 3B. 3C, we'll talk about sexual orientation.